It feels like every time you turn on the news these days, there's something about how young people are doing mentally in the U.S.
Yeah, definitely a lot of headlines about it, for sure.
And it's not just a passing trend. It's become a really major topic of conversation.
Yeah.
And for good reason. This deep dive that we're doing today, though, we want to kind of go beyond those headlines.
Right.
We want to understand what's actually going on, what's really happening, and then why should this matter to you listening?
Exactly.
So to get into this, we looked at some fascinating material. We've got excerpts from this really interesting episode of SmartPodcast.
Yeah, good one.
It featured Patrick as the host.
Yes.
And his guest was Harry, who is a mental health advocate and counselor.
Great guest.
Yeah, they had a really thoughtful discussion.
Yeah.
So what we're going to do is pull out the most important stuff from that, the most interesting stuff, and help you kind of get a clearer picture of all this.
Yeah, because it's a complex situation for sure.
It really is.
Multiple layers.
So for you listening, our mission is to leave here with a really solid understanding of the key trends that are happening in youth mental health.
Right.
What are the factors? And yeah, we are going to talk about social media, but what are the things that are kind of pushing this, and where do we go from here?
Yeah.
But we want to make sure we do this in a way that's interesting, that's engaging, and leaves you feeling more connected to this, not overwhelmed.
Yeah, just like a data dump.
Yeah,
Yeah.
exactly. So let's just jump in, unpack this a little bit.
Yeah, let's start by really understanding the scope of what's being called a crisis.
Yeah.
SmartPodcast, they highlighted some really striking statistics.
Yeah.
Between 2010 and 2020, there was a nearly 60% increase in adolescent depression.
60%.
Yeah, and we're not just talking about the blues or just feeling down sometimes. This is about persistent low mood, loss of interest, the things that really affect your life, your sleep, your energy, your appetite.
Yeah.
So that's a huge shift. I mean, 60% in a pretty short period of time.
Yeah. It's not like we went up a little each year. That's a big jump.
Yeah.
And, when you start putting it like that, it's like, okay, this is not just some kind of gradual rise.
Yeah.
This is like, wow, something's different about the landscape of what's happening for young people.
Yeah, definitely a change. And it's not just about how many people are reporting depression.
Right?
The material we looked at pointed to some even more concerning trends.
Yeah.
Suicide rates among young people aged 10 to 24 have also gone up considerably. And it's important to note that this isn't affecting everyone equally.
Right.
It's particularly pronounced among teenage girls and Black youth. So these groups are facing very specific pressures.
Right.
And, these numbers really make it clear how urgent this is and how we need to really focus our attention on those groups.
It does feel like it hits you a little harder when you see those specific groups, because it's like, okay, this is not just a general, everybody's affected the same way. It's like, no, this is affecting people differently. And it's not just about the extreme cases either, right?
Exactly.
Like the stuff that we read about, the stuff that we looked at shows that, more and more young people are just saying, I'm anxious, I'm stressed.
Right.
And it's like to a point where it's affecting their day-to-day life. It's not just like, oh, I'm worried about this test.
It's beyond the normal.
Yeah, it's like, no, I'm worried all the time. And that makes it really hard to do well in school, to have good relationships, to even function.
Absolutely.
And then the pandemic hit. Talk about fuel on the fire, as Harry said on SmartPodcast.
Yeah, very apt analogy.
That's like everything got so disrupted so suddenly. Schools closed, routines vanished, you couldn't see your friends.
Right.
So many normal activities just went away.
Especially social activities.
Yeah, and that had a massive impact on young people, many of whom were probably already dealing with some stuff. And you see it reflected in the data, right? More loneliness, more self-harm, even more young people thinking about suicide during that time.
Really intensified the existing challenges.
It's a lot.
It is.
And it's like you start thinking about all these things, coming together, and you're like, how are young people even coping with all of this?
Yeah.
And it's hard to have this conversation without talking about social media and technology, right?
Yeah.
It's just so woven into the fabric of their lives these days.
It really is.
So how do we even approach that?
Well, the SmartPodcast episode did a good job of highlighting the fact that it's not a black and white issue.
Right.
Social media has both good and bad sides.
Yeah.
On the one hand, it can be a really valuable tool for connecting with people.
Yeah.
Finding your community, finding support networks, especially if you're isolated geographically or otherwise.
Right.
And, it can be a source of information and even a platform for positive self-expression.
Which is easy to forget sometimes.
It is.
Like, it's so easy to just focus on the negatives.
Yeah.
But I think it is important to remember that, like, there are good things, there are upsides.
Right.
But we hear so much about the downsides.
We do.
And it feels like those are more prominent in the conversation around mental health.
Yeah, and for good reason, they are significant.
Yeah.
You know, the information we've seen, the constant comparing yourself to others online,
Yeah.
those carefully curated, often totally unrealistic presentations,
Yeah.
it can really make you feel inadequate, make you feel less confident.
Yeah, it's that highlight reel problem.
Exactly.
It's like everybody's showing you their best selves, their most perfect moments.
Exactly. And then there's cyberbullying,
Yeah.
online harassment, spreading rumors, you know, all that digital abuse. It's very real.
Yeah.
And it can be incredibly damaging.
Yeah, and it's often relentless, right? Like it can follow you everywhere.
That's right. And then you have the constant exposure to unattainable beauty standards.
Yeah.
And just content that can be really harmful, really triggering, or just completely overwhelming.
It's like a fire hose of information and stimulation, a lot of it not so good.
Exactly.
And, you know, when you're already feeling down or insecure, it's that much harder to handle.
Right.
And the SmartPodcast guest specifically mentioned, you know, the link between how much time teenagers spend on social media and how much anxiety and depression they report feeling.
Yeah, they cited some interesting studies
Yeah.
that suggest there is a connection, a correlation between more social media use and higher levels of anxiety and depression in teenagers. It's important to remember correlation doesn't automatically equal causation.
Right.
But, you know, the connection is there.
Yeah.
We need to think about it carefully. And it raises a question, you know, how is this connection actually happening? How does this work?
Yeah, like what are the mechanisms?
Yeah. For example, you know, when you're constantly comparing yourself to others online, that can trigger negative self-evaluation. You know, that fear of missing out, FOMO, that can lead to anxiety.
Right, that constant feeling of like, I should be doing more. I should be having more fun.
Right. Exactly.
It can be really hard to escape that feeling.
It is. And it's not just about the time spent scrolling.
Right.
It's also about how you engage with the content and the impact that has on you psychologically.
Yeah, absolutely.
Yeah.
It's the quality of the engagement, not just the quantity.
Exactly. And speaking of quality of engagement, what about this TikTok brain thing you hear so much about?
Oh yeah, TikTok brain, that's everywhere. What is that really?
Basically, TikTok brain refers to how these popular social media platforms, especially the ones with these short videos,
Yeah.
they can affect young people's attention spans. That constant barrage of new stuff, new information, new stimuli, it creates these little bursts of dopamine.
Like those quick hits.
Yeah, exactly, those little rewards. But over time, that can make it harder to focus on things that require more sustained attention.
Yeah.
You know, like studying, having a deep conversation.
Yeah.
Even just trying to process your own emotions.
It's like our brains are getting rewired for short bursts,
Right.
which then makes it harder to do all that stuff.
Yeah. Like schoolwork, meaningful relationships, even understanding ourselves.
And Harry had this great analogy on SmartPodcast about it. He compared it to like a fast food diet for your brain.
Oh,
It's
perfect.
like you get this instant satisfaction.
Yeah.
But in the long term, it's not doing you any good.
Right.
It's like we're being trained to only want those quick hits, those little bursts of attention.
Right.
So we have a better picture now of just how big this problem is and how social media fits into it.
Yeah.
Where do we go from here? What can we even do about all of this?
Well, the SmartPodcast discussion really stressed that there's no magic bullet.
Right.
It's going to take a multifaceted approach.
Okay, so multiple angles.
Yeah, and it starts with awareness. Parents, educators, policymakers, everybody needs to understand just how serious this is.
Yeah, that it's a real problem that needs to be addressed.
Exactly. And they talked about 3 key areas for action.
Okay, let's get into that.
Yeah.
So first one, early intervention.
Yeah, early intervention is absolutely crucial.
What does that look like practically?
They really emphasize the need for mental health programs in schools,
Okay.
having counselors readily available.
Yeah.
The idea is to catch these issues early
Yeah.
before they become big problems.
Right.
So that could mean mental health screenings, educational programs to reduce stigma,
Okay.
and making sure there are qualified mental health professionals right there in the school environment.
So you're catching things early and hopefully saving lives.
Right. That's the ultimate goal.
So yeah, that makes total sense. If we can give young people the tools they need early on,
Right.
then maybe we can prevent some of the more serious problems down the road.
Exactly.
Second key area, parental guidance.
Yes. They really highlighted how important parents are in all of this.
Yeah.
And that means creating a space where kids feel comfortable talking about their feelings. Like a safe space.
Exactly. And having open conversations about mental health.
Not shying away from it.
No.
Like being willing to talk about it even when it's uncomfortable.
Exactly. And parents need to know how to recognize the signs of a problem.
So like being educated themselves.
Right.
Okay, so it's like open communication and parents being active listeners and a source of support.
Exactly.
And the third key area, promoting healthier tech use. I feel like this is big, especially given everything we just talked about with social media.
Absolutely. They talked about a bunch of strategies to help young people have a more balanced relationship with technology.
What kind of strategies?
Encouraging digital detoxes, you know, taking breaks from screens.
Yeah, like putting the phone down, stepping away.
Right. Setting screen time limits.
Yeah, like having some boundaries.
And promoting real-world interactions.
Getting out there, doing stuff.
Exactly. So it's not about banning technology.
Right. It's about using it consciously and in a balanced way. Like Harry from SmartPodcast suggested, having tech-free family time every week.
Oh, I like that.
Yeah.
So it's about finding that balance.
Exactly. And one of the positive things they pointed out is that it seems like attitudes towards therapy are changing.
Oh, that's good to hear.
Yeah, they said that more teenagers are open to therapy now than they were a decade ago. So maybe we're finally starting to get rid of some of that stigma around mental health.
Yeah, that's a huge step.
It is.
And the way we access help is changing too, right?
Yeah.
Teletherapy, mental health apps, all that.
Absolutely. Teletherapy has made it so much easier for people to access help, especially if you live in a rural area or have trouble getting to appointments.
Yeah.
And while it's important to be cautious and look at them critically,
Yeah.
there are some mental health apps that can be really useful.
Right. As long as they're evidence-based and not trying to replace human connection.
Exactly. They need to complement real support.
Yeah, not try to be a substitute for it.
Right.
But all of this is really valuable information.
Yeah.
And, I thought it was really important that they took time in SmartPodcast to talk directly to any young people who might be listening and going through a hard time right now.
Yeah, definitely. That was a powerful part of the episode.
It was.
The message was so clear. If you're struggling, you are not alone.
Yeah.
And it's important for young people to hear that their feelings are valid and that there are people who care.
Yeah, to feel seen and heard.
Absolutely.
And they had a really clear call to action, right? Reach out, talk to someone.
Yes. Talk to someone you trust. A friend, a family member, a teacher, a school counselor, a therapist.
Yes, take that first step.
Exactly. Because sharing what you're going through can make a huge difference.
And they shared a really important resource for anyone in immediate crisis.
Right. 988, the Suicide Crisis Lifeline.
Yeah, people need to know about that.
Yeah, it's a national network, completely free and confidential.
24 hours a day, 7 days a week.
That's right. For anyone who needs help, anyone who's having thoughts of suicide, anyone facing a mental health crisis.
So just to recap everything we've talked about in this deep dive.
Yeah.
We've looked at the rise in these youth mental health challenges.
Right.
Things like depression and suicide. We've talked about the complicated role that social media plays.
Yeah.
And all the things we can do to move forward.
Early intervention, parental guidance, healthier tech habits.
Right. And changing attitudes towards therapy.
And more access to resources.
It's a lot.
It is.
But just understanding these trends, even just knowing about these resources, that's a big first step.
It really is.
It's a complex issue, right?
Yeah.
There's no easy fixes. But it feels like we're starting to have the right conversations.
We are. And I think that's key.
It makes me think, technology is changing so fast.
Yeah.
It's such a big part of young people's lives. What's it going to be like for future generations?
Good question.
How are they going to stay mentally healthy in a world that's even more digital than it is now?
Yeah, it makes you wonder what kind of support they're going to need, what kind of coping skills.
And what role are we going to play in creating that world for them?
All right, what can we do now to prepare them?
That's something we all need to think about. Thanks for joining us on this deep dive.
Absolutely.
And keep those conversations going.
Yeah.